Good morning. I'm Muriel Bowser. I'm the Mayor of Washington, D.C., and today I'm providing a situational update on the district's response to COVID-19. We are continue to closely follow all of the information related to the coronavirus in D.C., and we know a number of people are eager for an update on Phase 2, and as we continue to plan for Phase 2 and monitor the data, we continue to look closely at any changes related to entering Phase 1, and we'll have an update on Phase 2 later in the week. This morning, we announced 32 confirmed cases of COVID-19, bringing our total number of people infected with COVID to 9,800. And I'm also relieved to report this morning that we do not have to announce any additional lives lost. And Dr. Nesbitt will be happy to talk a little bit more about the curves that you see before you. Let me also say a little bit more about testing. Since we moved into Phase 1 on May the 29th, we have been very focused on how we can ensure that anyone who needs a test gets a test. And one of the updates that we made 2 weeks ago is that we began offering free fire testing at firehouses across the district. I want to thank Chief Dean for working with DC Health and with EOC and Director Geltart and all of our team at EOC and HCMA for ramping up this testing at firehouses across the district. The sites have been very popular, and already more than 2,700 people have been tested at a firehouse. The success of these sites can be seen in the chart before us. The week before the firehouses went online, I think those numbers refer to the district sites. 1,534 tests were given, and during the time that the firehouses have been up and running, more than 5,900 tests have been given. So as you can see, that is a huge number of people going to their local firehouse. So I think that's a testament to how people feel about their local firehouse and our fire and EMS personnel. So thanks for your collaboration, Chief. And starting today, we are expanding testing at our firehouses. Instead of 2 sites each day, we will now begin to offer 4 sites each day, Monday through Friday. And the hours are 4 p.m. to 8 p.m. during the week and 12 to 4 on Saturday. And so you can see the full schedule ahead of you. Also, beginning tomorrow, the district at our locations will now be able to sample children who are 6 years old or older. Previously, the minimum age had been 18. I also want to emphasize, however, that if your child is sick, you need to contact your child's provider. Similarly, if you are sick, while we're offering these free sites, it's always best to connect with your own provider. Additionally, Children's Hospital continues to offer drive-through and walk-up testing for pediatric patients who have a physician's referral. So again, there are many opportunities without a registration to go to walk-up testing. Finally, I want to mention that the district is now offering free antibody testing available to DC residents. This, of course, is not the test that tells you whether or not you currently have COVID-19, but whether you were previously exposed to COVID-19. The results of these tests will help DC Health learn more about the rates of exposure in the city. And so residents interested in getting an antibody test should call 1-855-363-0333 to make an appointment. So with that, the team, is there anything that you want to add before we take questions? Okay, any questions? Yes.
Those antibody tests, where do people go to get them? And if they find that they do have antibodies, should they feel themselves to be protected? Should they act differently than if they didn't?
Dr. Nesbitt.
I'll start with the last question first. No, they do not act differently if they are found to have the presence of antibodies. I will say that a number of district residents have been able to have antibody testing through their healthcare provider. So one of the things that the mayor has stated today that I want to emphasize is that while we have expanded the number of publicly supported testing options, we want people to be connected to their healthcare provider, and we have done that type of communication as well. What we have done is we've established a public testing site for serology or antibody testing. The first location that we have is at Canal Park in Navy Yard, and we will hope to have a second option available. These testing locations will only be available through the first week of July, and this is for us to do what's called the seroprevalence survey, which allows us to be able to get a better estimate of the percent of district residents, a proportion of district residents who have been exposed. That notwithstanding, healthcare providers can order antibody tests, have those tests sent to commercial laboratories like LabCorp and Quest, and help patients determine if they have the presence of antibodies. There's still a lot we're trying to learn about what the presence of antibodies mean. Typically, when someone has antibodies to a virus, it may mean that you are immune. We do not know that yet about SARS-CoV-2 antibodies and what it means for your immunity to COVID-19. So even if you do have the presence of antibodies, we still need you to social distance, to wear mask and face coverings when you cannot safely social distance, when you're indoors, when you're in retail locations, when you're in restaurants or dining outdoors outside of when you're actually consuming the food, and to practice good hand hygiene. All of those things will still be relevant for anyone who does have the presence of antibodies.
Yes, Sam.
Yes, Mayor. You were talking about phase 2. So that could come as soon as Friday? I'm hearing some things. Can you talk a little bit more about it and what it means?
I can talk a little bit more about it, and based on the Department of Health's recommendations and analysis of the trends, we talked last week now, that June the 19th would likely be the earliest that we could enter into phase 2 if our numbers continue to trend down. And you see there where we are with community spread in phase 2 represented by the second shaded area. Dr. Nesbitt, do you want to add anything to that?
Sure, and we've talked about the other important metrics, and I don't know if you've been with us or able to follow along, Sam, but we've also talked about the release of our dashboard, where the other metrics that we are following, like hospital capacity, the rate of transmission, and our contact tracing ability. So all of those metrics are there, and we'll be guiding our recommendations to the mayor around those, and as she's mentioned, we'll be giving an update as to phase 2 and what phase 2 could look like later in this week.
Metrics that you're talking about headed in the right direction?
So far, we have not seen any substantial changes in the data metrics that would cause us to have to indicate to the mayor that we need to, that we would at this point have a substantive change. What I will say is that we have had more testing. We may see more lab results come in as a result of that increased testing, but heretofore we have not seen a reversal in the declining trends.
As soon as June 19th?
That is correct. Our recommendation to the mayor was that the earliest we would be able to enter into phase 2 would be June 19th, and we have not changed that recommendation.
So have a little patience with me, but can you tell us what, for the general public, this is going to mean if you go to phase 2?
I can't right now, Sam, because we're still evaluating some of the recommendations that came from the advisory committee on reopening. on the things that could be loosened in phase 2. So the earliest I'd likely be able to talk about that is midweek.
You've looked at some of the states, I guess, that have opened up more in many cases. I don't know if it's phase 2 or what it is. What are your thoughts as you look around the country and you see places that have opened up?
Well, I have said frequently here that we don't have a treatment or a cure, so therefore when people start coming out, we're likely to see more cases. And it looks like that is especially true in places that didn't go through the slow phased reopening that we're going through. So I can't really say anything more about that other than they're having some steep increases right now. We have been able to flatten our curve and our cases continue to decline, which is a good thing. But we have been going at the pace that we think the data suggests we should. That's not to say that we can't at some point have more cases when we see more activity.
This is your second day in a while, I guess, when you've had no deaths at all, which I guess must make you feel pretty good.
It makes me feel very good. Yes.
Just to follow up on those metrics, when are we going to get the metrics about contact tracing on the dashboard?
We hope to possibly have that metric today or tomorrow. The staff is doing the work. We are onboarding an additional 100 contact tracers today. We have 200 now. This will make 300. So the work is ongoing. Again, we can't continue to measure the work. It's the issue of automating that data feed into the dashboard. But we are measuring it.
And is that number meeting the target right now for phase 2?
We are not at the 90% that we want to be, but we are advancing toward that goal.
Thank you.
Yes, Paul.
Dr. Nesbitt, I'm just curious. I think Maryland has a 7% positive test rate, I believe. What is the district's?
Today, we've measured at 11.3%, but it's been below 15% for 7 days. But if you go to the dashboard, you can see what it has measured on each day. We've had some days where it's been below 10%.
Okay. When I'm looking at these, like June 10th, there were 1,227 tests conducted. I don't know if you can answer this question.
Paul,
but
I'm sorry, what are you looking at?
This page 3.
Okay.
It says June 10th, there were 1,237 tests, I'm sorry. So do you know, Dr. Nesbitt, whether or not those test results from that day would be included in today's data?
So it depends. Some of the test results turn around anywhere from 48 to 72 hours, or it could be longer depending on how many tests were still in the queue to be run from previous days. We talked a lot about what the daily capacity is of the public health lab. As you can imagine, when we have this many tests that are coming in from a publicly supported environment, then it increases the turnaround time from that 24 hours to be closer to 72 hours. When you're pointing to any specific day, it's hard for me to tell you definitively if it's reflected in the positivity numbers. You also have to remember that our test positivity rate is not only a reflection of how many tests were done at the public health lab, it also includes tests that were done by clinical labs and commercial labs. So it's the total test for all district residents regardless of laboratory.
All right, looking at June 12th, there were 1,679.
I don't have the dashboard in front of me, so I'm not gonna answer you definitively if you ask me specific questions about the positivity rate.
Okay.
Thank you.
All right. Mayor, can I ask you a question?
Yeah.
Over the weekend, we published a story about some comments that Chief Newsom made to his force in a video message. in which he said that the DC City Council had completely abandoned them, that they had been involved in reform over the last 20 years, and that it was an insult what they had done. You have said you're going to sign, if you have not already done so, sign the emergency legislation that they came up with. It would seem that your position is at odds with the chief. Would you agree with that, or do you have any comment on it?
I think I heard the chief say that he was concerned about emergency legislation that he hadn't fully weighed in on and fully had a chance to work with the council members on. I've also expressed a concern about doing anything in a rushed manner that doesn't consider all the consequences. And that's why we asked the council to work on the emergency, and let's have some more time to work on the permanent.
Are you at odds with the chief over his comments? Did you see his comments?
I recognize that the chief is a 30-year police officer who has given all of his career to DC government, and I can understand his frustration. Okay, any other questions? Yes.
For Chief Dean, I guess this has been going on for a while, the testing at the firehouses.
It just started recently, Sam.
Well, I mean, yeah, recently, but I'm just curious, any kind of reaction at the firehouses to it? How's it working? What are your thoughts? That sort of thing.
It's working well. The firehouses, it's happening outside the firehouse. The tents are coming. We have about 40 people that have volunteered to be a part of it. We're onboarding another 50 people this week. The operation itself runs very smoothly. We're able to take care of the citizens, able to make the citizens feel like they're the most important thing. Where they've stayed over past 8 o'clock to make sure people in line are taken care of. So for us, it's worked very well.
You said on board. What do you mean?
Onboarding, well, we have people that are testers, and they're being trained by the health department in forensic science to be able to do the testing. So, that's what I mean by onboarding them.
So firefighters
Are able to
trained as
do the testing, correct?
I see. And so what? I guess these firehouses are out of commission during this time, or?
No, the firehouses are in operation. The tents are set up outside the firehouse, which allows people to line up and be able to do their tests right there, and continue to operate the firehouse at the same time. We're not using the on-duty members to be able to do the testing.
Okay, so are these volunteers, or are they working their days off, or how's that work?
They're working their days off.
I have a question for Chief. Chief, I've heard that perhaps some of your firefighters who had tested positive and have recovered have volunteered to donate plasma to a hospital. Can you tell us any more about that?
So a number of the firefighters that tested positive, there was a study that came out and asked would they be willing to donate plasma. We've had a number of firefighters that have stepped up to be part of that solution also.
Do you know how many? And
I do not have the number of how many have actually done it so far.
what do you think about that?
Well, I think it's awesome that people are willing to help globally, everything that's happened with this pandemic. So very proud of them, very proud that they're DC firefighters and EMS employees.
And that's a completely volunteer program?
That is volunteer also, yes.
Can I ask you, there's been a lot of street violence in the last few days. It's really shocking. Some videos that we've seen, gun battles in the street. 2 19-year-olds were murdered over the weekend. Do you have any comment on the violence that's going on out there?
I'm just as shocked as you are. I saw a video that was showed, I think, on your air on Fox 5 that just shows you the rampant problem we have with guns in the city and people having access to guns, stashing guns, shooting guns in broad daylight on a street, and how we need everybody in the public, everybody in law enforcement, everybody in violence interruption to be fully engaged to find who's doing the shooting so that we can get the guns and get them off the street. Any other questions? Okay, thank you.